everyone, welcome back to the Weekly Wellness Podcast. I'm your host, Dr. Rebekah, and today we have joining us Dr. Rodney, who's our Director of Wellness and Personal Growth.
Hello, everyone.
Thanks for joining us, Dr. Rodney.
Absolutely. I love it every time.
Yeah, likewise. Glad to have you back. Very excited to talk with you today about boundaries.
Yes.
A very important topic, I feel like, in vet med, but generally as well.
Right.
So I'd love to start with just the idea of, this idea of setting boundaries. I feel like we all talk about it, but what does that mean? What does it mean to set healthy boundaries?
That's an excellent question. I'm a therapist. You can't be a therapist unless you understand boundaries.
Right.
I do want to say that some therapists don't have a good handle on the boundaries. They really don't, so you have to be careful. I'm not trying to be arrogant, but I've been taught traditionally regarding boundaries. And so when you understand what boundaries actually are, you'll understand the importance. A bad boundary is one where I'm trying to control you and tell you what to do.
Right.
Do I have a right to tell you what to do?
Generally, no.
Do you have a right to tell me what to do?
Definitely not.
So a lot of times, especially in parenting and stuff like that, or even in spousal relationship, it becomes boundaries of control. I'm going to tell you what to do. Here's my boundary.
Right.
You have to do it this way. Okay? If the motivation behind the boundary is to control another person,
Right.
that's an inappropriate boundary. Most people don't understand that. So what is the appropriate boundary? What is the correct boundary? A boundary is actually one that protects me from your bad behavior. I can't tell you what to do, but I have a right to be protected from your bad choices and your bad behavior.
Right.
That is an appropriate boundary. Why is that appropriate and the other one inappropriate? Because if I try to control you by telling you what to do, it's going to fail because I don't have that much power.
Right.
I can tell you what to do, but I can't control you ultimately to make you do it.
Right.
However, when I have a boundary of protection to protect me from your bad behaviors, that is definitely attainable as long as I follow through with the consequence of the boundary. I can maintain that every single time. Does that make sense to you?
It does. I'm curious what you meant by the consequence of the boundary.
Well, a boundary not only has a statement to it, what this is my boundary, but you always have to have a consequence if the boundary is not followed, if the other person dismisses the boundary or doesn't follow the boundary.
Okay.
Does that make sense?
It does.
Okay.
Yeah.
Let me give you just an example, all right? Let's pick smoking. My boundary is you can't smoke. Well, that's dumb.
Right.
Even
Not
if you
gonna
tell a student,
Yeah.
a kid, a child, or a spouse you can't do it, when you're not around them, you cannot enforce the boundary and they're going to lie to you, which makes other problems happen, okay?
Right.
It's an inappropriate boundary for me to tell you you can't smoke. However, I can have a boundary of protection around your smoking. My boundary of protection is I'm allergic to smoke. It annoys me. I don't think it's physically appropriate and I don't want to have consequences from breathing your smoke. So my boundary of protection is whenever you're around me, whenever we're in the house, you cannot smoke. See, that's not telling you what to do. I don't care what you do when you're out on the street.
Right.
I do care, but I can't control that. I can't influence that.
Right.
My boundary is that when you're around me, when you're in this house, I'm asking you not to smoke. If you do smoke, my consequence will be I will immediately tell you to go somewhere else and smoke, not in front of me. Leave the house for a period of time.
Right.
You get what I'm saying? Can you follow through with that? Absolutely. They're smoking. My boundary was you're not smoking in front of me. You're smoking right now. Please leave and come back when you're done smoking. Can you enforce that? Certainly.
Yeah.
Okay? I'm not asking you to get in a fight with them physically or otherwise, but do you understand the difference?
Yeah.
Okay? So boundaries where I'm just trying to control the other person is all about you trying to control another person who made you God.
Right.
Right? But a boundary that protects me from your bad behavior is definitely something you should follow through with. Everyone should have boundaries regarding their relationships, at home, with spouses, with children, at work.
Yeah.
All of those are appropriate. as long as it's set up in a way that the reason I'm doing this is not to control you, but I need to be protected from your bad choices. Does that make sense?
It definitely does.
Okay.
Yeah, and that's really interesting. You know, you mentioned, is it possible to enforce this? Yes. Is it easy to enforce sometimes? I think we all know the answer is no. It can be really challenging to set those boundaries, especially for people that maybe in vet med are more prone to people pleasing, or, you know, have that sense of disappointing others if we try to enforce those boundaries.
Right.
So what are baby steps that people can take to start setting boundaries and to say, this is something that I'm going to be firm on?
Start with boundaries that can easily be enforced with the consequence. You know what I'm saying? Take the baby steps and don't come up with a really big one right away. Once you get them to the point where they understand that your boundary is important to you and they can follow through, then when you get to the bigger ones, they'll be easier to follow through with. Okay. That would be one thing. Yeah. So again, whether it's in the family or even at work, you set up a boundary of protection against you. Maybe, for example, there is not a boundary at work around cursing. Let's just use that as an example. And so cursing goes around quite often. Can you control everybody at work? No, you can't. Nope. Okay.
Right.
However, can you say to a staff member who might be in your vicinity and is cursing, or when they're with you, my preference is that you not curse when you're here talking to me. If you do, I'm going to ask you to leave the meeting or leave the room. Can you enforce that?
You can.
You can.
Yeah.
Because it's a boundary of protection.
Right.
Okay. So if you have the right, so when you set a boundary, you always carefully explain the reason behind the boundary.
Okay.
Again, I'm not telling you whether, I'm not saying you're going to die and go to hell or something because you're swearing.
Right.
Okay. This is a protection for me. Yeah. It bothers me when I hear those words. And so I'm asking you that not do it to me and in front of me.
Okay.
Doesn't everybody have a right to say that? Okay.
Yeah.
Now, what happens if they won't leave the room? So what's your option to enforce the boundary?
You ask them?
Leave. Yes, you ask them, even if it's your office.
Yeah.
And they're swearing at you. I'm going to enforce my boundary. Please leave. No, I'm not going to leave. All right. Bye.
Yeah. That's
what are they going to do?
fair.
Tackle you? But you understand what I'm saying? That's so. The consequence can always be enforced if there's always a way for you to enforce it if they refuse not to follow through with the consequence.
Gotcha.
Okay? So let's go back to the original illustration. Let's say it's something at home and your teenager is smoking in the house and or your spouse is smoking in the house and that's your boundary, don't smoke in the house or in front of me. They won't leave. What's your option?
You leave.
I'm going to leave.
Yeah.
Well, that's not fair. But routinely, if you do that, it sends a message to them. And what's the message that they receive?
That you're bothered by their smoke.
And I'm going to follow through with my boundary of protection.
Yeah.
Even if it means that I have to go and someplace else and spend the evening someplace else.
Right.
Or go to the grocery store or whatever to get out of the presence of you crossing my boundary of protection. And boundaries are all about maintaining relationships.
Have you heard about our weekly wellness rounds? If you're a veterinarian, you know more than anyone how tough life can get. Whether it's dealing with difficult clients, communication challenges on your team, issues in your personal life, or even just a busy week where you feel like you haven't been able to stop and actually catch your breath. There are so many things that come into our lives that can impact our mental health. So that's why we've started our weekly wellness rounds. This is a judgment-free place to come talk through your experiences with other veterinary professionals who get it. These conversations are moderated by our Director of Wellness and Personal Growth, Dr. Rodney Robertson, who is also a licensed mental health professional. Weekly wellness rounds take place on Wednesdays at 7 p.m. Central Time, and all of these meetings are virtual, so there's no need to stress about adding yet another trip to your busy week. You can register and join our weekly wellness rounds by visiting our DVM support website at mypetswellness.net/DVM support. So join us for weekly wellness rounds on Wednesdays at 7 p.m. Central. We hope to see you there. Maintaining relationships. So do you think that that relationships are improved when people have these kind of well-defined boundaries.
Absolutely. They always work when you can follow through in the way that I've described.
Okay.
Now, I know we're going to get to power differentials between bosses and stuff like that, and parents and children. That's where it gets complicated, but I don't think we have 5 days to talk about this. I'm trying to give you the big picture.
Appreciate that.
But here's the situation. It's all about the relationship with a spouse, partner, child, co-worker, boss, or whatever. All of those have to be based upon a relationship.
Right.
If a person sets up a proper boundary of protection against some of your behaviors and you're not willing to follow through with that, do you really have a relationship?
Yeah.
Or we switch it around, okay? So they're continuing to do the thing. What does that say to you? They're not really in a relationship with it.
Yeah.
We're playing house or we're playing office.
Right.
So then you still have an option. Now, this is the part you're not going to like. Okay? That if you have no relationship, leave the relationship.
Right. If that boundary is not being respected.
If they consistently disrespect the boundary,
Right.
put boundaries of protection and leave the relationship, you still love them with the child.
Right.
Or with the partner. Or with the coworker.
Yeah.
Okay? Or with the boss. What does that mean?
Yeah.
You get another job to protect yourself. If you
Interesting.
don't follow through with the consequence of the boundary, they will keep doing it and you'll never have freedom from their inappropriate behavior.
Right.
Does that make sense?
It definitely does. I would see how that could be more challenging with some of those like family dynamics, like with the child or with a spouse. So I'm wondering if somebody is, you know, you mentioned to set these boundaries, to start with baby steps. It's important to explain yourself, to make a very clear boundary, to have a clear consequence for that boundary, which initially is asking that person to respect that boundary. And then if they don't, to then have a backup option for how do I get myself out of this discomfort that I'm experiencing?
Right.
Or how do I maintain my protection, like you said, from this circumstance that I don't enjoy? I would see how that in a work environment could be a little bit more straightforward sometimes, right? Like this person's not respecting my boundary. I've made it very clear, so maybe I should look for another job. I feel like with those more intimate relationships with family members, with good friends, I could see that getting a little bit more dicey, where it's hard to say, well, maybe I'm just not in a relationship with that person anymore because they aren't able to respect that boundary. Is there an in-between?
Yes. Okay, so and there's actually an in-between of somebody in the office, okay? So it doesn't mean I'm going to quit today,
Yeah.
or I'm going to leave the house today, or I'm going to make you leave today. But incrementally, as they continue to not listen to your desire to protect yourself from whatever they're doing that's hurting you,
Right.
if they continue to do it over time, you put distance between them and you. Okay? What I mean by distance is not a physical distance. It's just I'm not going to interact as much with you. And the reason why is because you won't follow my boundary.
Right.
Okay? If that continues and they don't get the message that you're serious about the boundary of protection, not the boundary of control, then eventually you're left with the choice that clearly there is no real relationship.
Right.
So then at that point, that's where you would probably move out of the relationship by finding another job, or by getting transferred within the company to some other division,
Yeah.
or at home to actually leaving. Now again, you can't make them leave.
Right.
Maybe you can in some legal situations. But if they don't leave, then what do? Leave
Yeah.
permanently. And you just got to do it.
Yeah.
Okay? And well, that doesn't help our relationship, but you might help them the next time to learn that boundaries of another person need to be followed so they don't mess up that relationship. I just don't believe in staying in relationships where boundaries are not recognized and followed.
Right. Well, and I think that's a really important message, especially for people that, you know, are hesitant to establish those firm boundaries or are hesitant to enforce those firm boundaries, is that relationships are actually improved by going through that process and by having those boundaries.
Right.
And if somebody's not able to respect those boundaries that have been clearly verbalized, then maybe that's a little bit of an indicator. Let's pay attention to that. So I think that definitely makes a lot of sense. And, you know, personally, I would say, like, I am one of those people in veterinary medicine that finds it challenging to put up those boundaries at times, in various ways. And I think part of the perception is that there can be boundaries that are too rigid, or maybe that's an inappropriate boundary. How does one identify, is this a realistic boundary? Or is this something that, maybe I'm asking for too much? Is there any indicator that someone can say, no, actually, this is an appropriate boundary for me?
Yes, I do think that they can be too rigid at times. Okay. You as an individual have to decide where that point of no return is, in a sense.
Right.
But I think the first thing you do is check with yourself to make sure, am I really saying this because I need protection? Because it rises to that level.
Yeah.
If it doesn't, then don't try to set up a boundary around it. Okay? Let's go back to one of the illustrations about if they're swearing in the workplace.
Right.
Maybe your first step is, please don't do it when you're in front of me. And then you're going to have to not have a rigid rule about, I don't even want to hear it any place at the office, because that's not realistic.
Right.
I've got to be able to say, okay, I have a right, if they're right in front of me and they're directing it towards me, to protect myself from that. But if they're talking to somebody else and using those words, I've just got to get used to that, because it's a socialization situation and it's a culture where that type of thing is done all the time. So I just have to get along with that, because it's not really about protecting me.
Right.
I remember a day when there was very little cussing in public. That's a true statement. Now it happens all the time. If you can't deal with swearing in our culture, you're going to be staying in your house a lot and going nowhere and doing anything. And that's unfortunate.
Right.
But there's a difference if they're using it in somebody else's presence and I'm overhearing it, or if it's directed right at me or directly in my presence.
That makes sense. Yeah. So then it's a kind of self-evaluation to figure out, is this truly protective of me, or is this me trying to control my surroundings?
Exactly, which takes us right back to the beginning.
Yeah.
The boundary is about protection. It's not about control.
Okay.
If you evaluate and says, am I really trying to protect myself, or am I just trying to control them to do what I want them to do?
Yeah.
Then guess who's wrong? You are, for trying to control another person.
Yeah.
Okay?
That makes sense. One more just quick question here, and I know that we could probably talk about this for days, like you said. With veterinary professionals, I feel like one of our challenges with these types of relationships and with these types of boundaries is with our clients.
Right.
At times. That can be a really tricky dynamic, because they're heightened emotions. They a lot of times have really challenging decisions to make, and that communication can sometimes be strained, putting it nicely. So what do you recommend for the veterinary technician or the veterinarians out there that are dealing with these challenging clients to set these boundaries of respect and to say, please do not yell at me?
Right.
How do you set a boundary and enforce it when you're in that type of professional situation? And or as a therapist, have you had those types of issues?
Well, we have to make allowances if we're in a situation where we need the clients, or we'll end up with no clients.
Right.
No pet owners coming to us because our boundaries are so rigid. Now, again, I'm giving examples. You've got to adapt it to your situation.
Right.
Okay. So let's say that you're talking to a pet owner and the pet owner is angry. Okay. Well, they might have either a legitimate reason to be angry, or in their mind they have a right to be angry.
Right.
Okay. So you might have to listen to some things that are uncomfortable. Okay. But you start with something that you can actually follow through with. So, okay, so you're mad at me, you're yelling at me.
Right.
I don't feel comfortable with the present situation because it's getting intense. I'm willing to listen to you, but I have a boundary of protection. They come in two forms. You cannot touch me, or you cannot use foul language at me. Now, you have a right to say that.
Right.
I'm still listening to them. I'm not dismissing them.
Right.
Even if you don't like what you're saying, okay? My consequence is, if you approach me and touch me, or if you swear directly at me, I'm going to ask you to leave.
Right.
Okay? So let's say we're talking, and they start getting more agitated,
Right.
and they start using ugly words at you,
Yeah.
and they maybe get really close to you're afraid that you're going to be hit. I'm going to ask you, this is too much, to leave. What happens if they don't leave?
Then
What do you do?
Remove yourself.
Then you remove yourself, exactly.
Okay.
Never allow them to be between you and the front door or the
Right.
door out, seriously. In counseling, we're taught that.
Yeah.
You never have the client between you and the door,
Right.
because then they can block you from leaving if they're upset with you for some reason.
Exactly.
So you have to think that through from a mechanical standpoint.
Yeah.
Always make sure. Now, you don't have to do that with every client because they're fine. But if
Right.
you have an agitated client, make sure that you have access to the door if they attempt to block you. Okay? But see, that's just, it would be inappropriate, in my opinion, to say, I'm not going to listen to you as long as you're yelling at me.
Right.
Well, they might think they have a very legitimate reason to be angry. You might even agree. Allow them to have some freedom, even though it might make you feel uncomfortable, because now you're not protecting yourself. But you certainly have a right from being hit, or if you choose, to be swore at. If that's not a big deal to me, then I'll listen to any words you want to say to me, but just don't approach me so I'm going to feel like I'm going to be hit, or don't attempt to hit me.
Yeah.
See what I mean?
Yeah.
So you've got to decide, depending upon the person, what that actually is.
And you have to decide for yourself what your boundaries are,
Right.
and what you're able to tolerate. Because, like you said, some people, I would imagine for some people, the language that's used is not as triggering or not as damaging as maybe the volume.
Sure.
So it may be the inverse: is I'll
Yeah.
listen to anything that you have to say, but at a tone that's appropriate or at a volume that's appropriate. So
And at any point, you can amend the boundary.
yeah,
So my boundary is, let's just simplify it. I understand you're upset. I'm willing to talk to you and try to help you to understand what I'm thinking and what's happening with the animal. Please do not approach me or touch me, right?
yeah,
I feel physically threatened. Oh, I'm not going to touch you, okay? But they start banging on the walls.
yeah,
Okay, I have to stop this right now. Yes, you're not hitting me. But the fact that you're banging on the walls or you're throwing things around the room, that also makes me physically threatened.
right,
So I'm going to renew my boundary to not physically touching me, but also show no act of physical violence
right,
within the room. If they won't do it, leave.
Yeah.
Okay. Now, my experience with agitated clients and stuff, even though I'm not a veterinarian, that's happened. Okay. In most situations like that, what I prefer is not even necessarily ask them to leave, because they're probably not going to, because they're so aggravated. My first reaction is, if the boundary is violated, I'm going to choose to leave the room until you calm down.
yeah,
You know, because by asking them to leave, you're probably going to go raise it
Exactly.
even more.
yeah,
So just take the easier route and say, okay, excuse me, I'm going to have to leave the room. I'm willing to come back in when you calm down,
Yeah.
and when you're willing to follow my boundaries. You're at least listening to them. Most of the times, even when they're angry, they just want to be heard. They want to be listened to.
exactly.
But they have to do it appropriately.
That makes a lot of sense. And I think it's just good, things to consider, for us that are, dealing sometimes with clients that are challenged,
Right.
in their situations. And thankfully, we have a lot of amazing clients. So hopefully not something that comes up frequently, but always good to just have in mind for, how to set those boundaries, how to enforce them, what that means, how that actually improves relationships. I think that's all been very insightful. So really appreciate
Thank you very much.
all of your perspective on it. Thank you for joining us.
I know it's a
Awesome.
difficult subject. It really is.
It is.
It's a very,
Yeah.
but it's an important subject you have to learn. And you have to decide when you're going to go to the wall on it, if you get what I'm
Yep.
saying. Because sometimes it might be easier to just say, I'm really not at risk. I'm just going to let this go, even though I prefer some other outcome, because
Absolutely.
consequences can be too great for you to decide to follow through it.
Yeah. And I feel like that's something that's very personal and very much
Right.
you have to have that kind of introspection to realize what your goals are and what your own boundaries are. So highly individual in nature, it seems. But
Right.
awesome. Well, thank you again, Dr.
Thank you.
Rodney. Always a pleasure. And thank you all for joining us. We hope to catch you next time on our weekly wellness podcast.
Thank
All
you
right.
very much.